What do swallowing assessments check for in stroke patients? Imagine a stroke patient suddenly having trouble swallowing. Doctors need to figure out exactly what's going on to keep them safe and healthy. Swallowing assessments are key tools used in hospitals to do just that. They focus on checking for a condition called dysphagia, which means difficulty or impairment in swallowing. This can happen after a stroke because the brain controls the muscles involved in swallowing, and a stroke can affect those areas. During a swallowing assessment, healthcare providers observe how well the patient can swallow different textures of food and liquids. They look for signs like coughing, choking, drooling, or changes in voice after swallowing. These signs can indicate that food or liquids might be entering the airway, which is called aspiration. Aspiration can lead to pneumonia, a serious lung infection, so preventing this is a top priority. Assessments also evaluate the strength and coordination of muscles involved in swallowing, including those in the mouth, throat, and esophagus. They check if the patient can manage saliva without difficulty, or if they show signs of weakness or uncoordinated movements. The neurological control of swallowing is also examined, since strokes can damage brain areas that regulate these muscles. This involves testing cranial nerves that are essential for swallowing. Another important aspect is determining if the patient can safely start eating and drinking by mouth. The healthcare team will decide what types of food and liquids are appropriate, whether they need to be thickened or pureed, or if alternative feeding methods like a feeding tube are necessary. This decision helps prevent choking and ensures the patient stays nourished and hydrated. Nutritional status is also considered. Swallowing difficulties can lead to malnutrition or dehydration if not managed properly. So, assessments help identify those at risk and guide dietitians in creating personalized nutrition plans. Common tools used in these assessments include bedside tests like the water swallow test, where the patient drinks small amounts of water while the clinician watches for signs of trouble. There are also standardized tools like the Gugung swallowing screen, which help provide a consistent way to evaluate swallowing safety. These assessments are usually done within the first few hours or days after a stroke to catch problems early. The goal is to identify swallowing issues quickly, reduce the risk of pneumonia, and help the patient recover safely. Always remember, each person is different, and medical teams tailor their approach based on individual needs. If you or a loved one experience a stroke, it's essential to follow healthcare professionals' advice and get thorough swallowing evaluations to support safe eating and drinking during recovery.